This segment is sponsored by Richmond Vascular Center, offering relief without surgery.
Richmond Vascular Center has treatment options for those battling fibroids. Joining us this morning with more is Dr. Adam McLauren, interventional radiologist with Richmond Vascular Center. Thank you so much for being with us this morning.
Yeah, thanks for having me.
I feel like we have so many questions about fibroids and where they come from, how do they even develop, but first you just told me it's Fibroid Awareness Month. I had no idea there was even Awareness Month.
That's why we're here, because a lot of people don't know. So yeah, every July is Fibroid Awareness Month, and so we try to, at least in July, get out and make sure we are having this conversation to increase the awareness about what fibroids are and obviously what things people can do to get treated for them.
So what are uterine fibroids and how do people get them?
Sure. So uterine fibroids are non-cancerous or benign tumors that can grow in the uterus. They're actually the most common tumor of the female pelvis, and they are extremely common. About up to 80% of women, by the time they reach the age of 50, can actually have them. And so luckily, though, most of the time fibroids are what we call asymptomatic, meaning they don't cause any problems. But for a small portion of patients who develop fibroids, they can develop issues, and these symptoms can be quite debilitating. The symptoms usually peak around the ages of 30s to 40-year-olds, and the symptoms, the most common symptom can be heavy or prolonged menstrual periods, which can lead to anemia, which can be very devastating and debilitating to a woman's life. But also, as the tumors grow, they can lead to a number of what we call bulk-related symptoms, just due to the volume of the tumors. And so they can grow and press on other structures in the pelvis, like the bladder, and cause urinary frequency, or the colon and cause constipation. They can even cause back pain or pelvic pressure, and even press on the nerves that go down the legs and cause leg pain. Bloating is a common symptom.
Oh my goodness, this sounds like it could cause so many problems.
Yeah.
Is surgery the only option, or are there other treatments that would be available?
That's a great question. Many women, so let me just start by saying surgery is not your only option.
Okay.
But many women are told that they need a hysterectomy if they have symptomatic fibroids, but that is not always necessary. At our clinic, when we see patients, we always go through all of the full spectrum of their treatment options, including medications, lifestyle modifications, and also non-surgical treatments like uterine fibroid embolization. And our goal really is to help to educate and empower our patients so that they can feel comfortable with the choice that fits right for them.
How do you know if uterine, say it forward.
Oh yeah, Uterine Fibroid Embolization, right?
UFE. How do you know if that is something that you could choose?
So you would need to come to someone like myself, who is an interventional radiologist. We are the physicians who perform these types of procedures. And what we would do is sit down and have a full consultation where we get your history, and then we would also order an MRI scan to evaluate the uterus and see exactly what we're dealing with, because sometimes the symptoms that sound like fibroids aren't actually fibroids, and we just need to make sure we know what we're dealing with.
So with embolization, can that treat anything else other than fibroids?
It can. Embolization is just a fancy or a strange, weird term that just means to block up blood flow to a portion of the body. So it's been used all over the body. And nowadays we're even using it to treat knee osteoarthritis in a procedure called genicular artery embolization. It can be used even to treat hemorrhoids. It can be used to treat enlarged prostates in men as well.
Wow, it sounds like just so much information that comes with Fibroid Awareness Month. Where can folks go to learn more or get a consultation?
Sure. They can visit us at richmondfibroids.com or richmondvascularcenter.com, and they can come in and we can do a one-on-one evaluation, and we can review imaging and talk about all their treatment options and help them get a plan in action.
Well, that's great. They want to come see you, Dr. McLauren. Thank you so much for being with us this morning. A great conversation, bringing a lot of awareness.
Yeah.
Very interesting.
Appreciate it.
Richmond Vascular Center is located at 173 Wadsworth Drive in North Chesterfield. For more information, give them a call at 804-864-8346 or visit the website richmondvascularcenter.com. Connect on social